so just make sure you're clear about the definition, the underpinnings or tenets associated with that learning theory, specific examples, and how it aligns, those teaching strategies actually align with that learning theory. All right, and then the next one, who would have guessed, is exactly that. How do I correlate learning theories and domains to actual classroom and clinical learning strategies? Great question. Billings and Halstead, you all already knew where I was going to refer to. Chapter 16 gives you a wealth of information about active learning strategies. And then Chapter 19 specifically hones in on clinical teaching strategies, okay, that we should use that are evidence-based to best support our students. Learning domains, that's going to be pages 188 through 190 in the 6th edition. And when you look at this resource, it's going to break down the learning domain definition, the taxonomy, the different levels, the verbs associated with it, as well as some great examples of how to write those learning objectives that are going to align with the different levels on the taxonomy. The next question is, can you explain competency-based curriculum design? Excellent question. So these are the 2 tips we would share about curriculum design, specifically with competency-based. First of all, with competency-based, we want to begin with the end in mind. It's called the backwards design model. That allows us to think about what learning do I expect my students to be able to walk away with as a result of my ability to facilitate and really coach students related to those specific concepts. So we begin with thinking about, okay, my learning objective for today is to highlight questions that have been previously submitted by colleagues across the country. And the goal is that you're able to walk away with tangible information with clear direction about how to move forward. The reality is, listen to this point, we know that it's not only 300 or so nurse educator colleagues that have these questions. We realize that there are probably thousands of you all out there that have the same questions. So we want to maximize the time that we're spending together by answering these questions using the evidence. Okay, so our backwards design model was we knew there were questions out there. We know the content that is in Billings and Halstead. We wanted to bring that to you so you can move forward by collapsing time, right? That's our goal, and moving forward to achieve success on the CNE exam within 60 days. We don't want it to take you 7 or 8 years, and for some, I know, even 10 years, okay? So backwards design model is number 1. And then the second part about competency-based education is what's called criterion referencing. So we set a benchmark. This is what's required to validate competency. Anything below that, we do not validate competency. Okay, so it's very clear cut. It's based on criteria that we establish that students have to be able to meet. All right, a couple more and then we'll be done. How do you choose which exam? Great question. Well, we've talked about that, right? So go ahead and write down. If you haven't already, you can go back and watch this snapshot to recap again. How do you decide which exam to take? All right, and then last question or last comment, that they are very nervous about the nursing theories. I know. Well, here's the reality. There's probably going to be maybe 8 to 10 questions that are aligned with learning theories, and our best ability to be able to recognize the correct answer is going to be based on our ability to apply these learning theories in our everyday practices, right? Experience is the foundation, and we build on that by looking at content in Billings and Halstead in Chapter 14 to align my teaching strategies, such as unfolding case studies, such as flipped classroom models, such as reflection and discussions. I'm going to go back and look at Chapter 14 and figure out which learning theory do these teaching strategies actually align with.